I'll get us started as people are joining us. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you again for joining us for this week's cross-industry support session to assist you, businesses, in reopening in a safe manner. While this is a cross-industry session and we're going to talk about general topics at the beginning, please do not hesitate to ask specific questions about your industry or ask about resources specific to your industry. If you are new to today's call, please let me know in the chat so that we can make sure that we figure out how we get you the best resources that you need in reopening. At this time, I'm going to hand it off to my partner in crime, Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. And I'm hoping with my new headphone setup, people can actually hear me this week. So let me know if I need to get loud again. Okay, well, let's go ahead and get started. First up, we're going to go over the same things we go over most weeks, just a little bit about our case updates, a little epidemiological details, and then we'll jump into the mask order, public health order, and some, I think, helpful, hopefully illustrative interpretations that we've made recently that I think are important to share with everyone. But let's go ahead. So this is our 5-day average number of cases. This is from Tuesday. The good news I'll get into in a little bit, but we are still seeing that slow upward rise, and that's actually it's borne out at the state level as well. We're seeing a drop off here, but it's above where everybody wants it to be. And so we're still seeing a rise. There was news that came out that said, the models that we've shared in the past that showed the possibility of pretty high case counts by the end of August, people were saying, oh, that's not true. And we're still seeing that rise. The models are not perfect, they're predictive, and we're still seeing a rise. And I think that's important, especially to keep in mind, if you keep in mind what we shared last week about how well the county is doing in terms of mask compliance. So, as mask compliance goes up, as social distancing is maintained, predictive models that may show bad news may prove to be, they may have predicted a worse future than we see, but it is still important. We're still seeing rising cases, and so just be aware of that. In terms of our local epidemiological update, we saw a lower case count over the weekend, that's great, but it's sort of like we shifted all the testing from the weekend to Monday because we had a huge spike on Monday in terms of positive cases. So that's disappointing. Again, you saw that drop off in cases, so we are seeing a medium term or a short term decline, but we're seeing that rise overall. Again, I mentioned it last week, but I want to hammer it home again. We're still seeing disparities for our Latinx community, and that gap is widening, and I think that's really it's really a problem that we need to try and figure out how to address. Last week I shared a little bit about the population and the overall number of cases that we've seen. In the last 10 days, about 51% of our cases have been in the Latinx community. And again, that's for a population that's 14% approximately of the entire county. So that's a worrying trend, and I think we need to be aware of that as we think about policies and about how we work with the community. In terms of testing, we are seeing continued good news, and that good news is that our percent of positive tests, as you know, is going down. So we administer, I'm just looking at the facts here, our average number of tests is about 416 tests conducted per day, and that's really good. And as of right now, our current 5-day positivity average is about 2.4, which was up to 3.6 last week. So percentage is going down, and that's great news. So moving on, just quick review of the public health order. We had our 9th revision back at the very end of July, and basically it brought the public health order into compliance with the state facial covering order. There were a number of places where the order said you should wear a mask in X type of business, and now the order reflects what the statewide facial covering order says, which is that when you are indoors in a public space, you need to wear a mask. And this is on this slide, the sign here is the sign that the state is recommending you put in front of your business, just to let everyone know that when they enter that public indoor space, they need to be wearing a mask. And in terms of exemptions, there is the ability to claim a medical exemption. We encourage people, businesses, if you have someone who claims a medical exemption, you do not have to allow them into your business. You can provide alternatives. So if someone says, I don't want to wear a mask and I have a medical condition, and you don't feel comfortable letting them in for whatever reason, you can say, we can do curbside pickup, any number of alternatives that you may use otherwise, you can use to ask someone to not come into your business if they're unwilling to wear a mask. And that's really raised on the second bullet point. You as a business owner and your employees are allowed to deny access to anyone who comes in saying they don't want to wear a mask for whatever reason, medical exemption or otherwise. So I think that's a really important thing to point out in terms of a way to protect your employees as well as your other customers. I've shared this every week for the last 2 months or so. It's really about thinking about how we as a community want to spread our choices around in terms of risk. Oh, apparently I need to get louder. Okay, I'm working on it. We need to figure out how to conduct our lives, but minimize our risk. And so that's really what this chart is shared from the state. How we can help as Boulder County Public Health. We want to provide information sharing like these sessions. We help interpret the orders that come down from the state. We provide enforcement. We have members of our team who support outbreaks and sick employees. We're an information resource if you have questions about how to protect the rest of your staff. If you have one employee who either tests positive or is suspected of testing positive. And we want to link you to all the resources. Our website just recently got updated to try and make it a little bit clearer. And the CDPHE website, covid19.colorado.gov, has a ton of resources broken down by sector. You can really dig into what your business is and what the requirements are from the state. In terms of how to reduce transmission as individuals, I added this slide last time because I think it's just really good to reinforce this stuff across the board. We want to wash our hands regularly, maintain physical distance with those outside of our household, wear a mask when you're indoors or when you can't maintain physical distance outside. That caveat, that's a Boulder County only rule. That includes all the municipalities have to follow that. If you're outside and you can't maintain 6 feet of distance, you need to be wearing a mask. And then monitoring your health, just being aware of how you feel, and trying to either stay home from work if you have to go to work, or avoiding group gatherings if you're not feeling great. Also a good idea to avoid group gatherings anyway. In terms of reducing transmission as a community, following the facial covering order, following the public health order, and cleaning and disinfecting our public spaces, public indoor spaces, is really important as ways to reduce spread. So recent interpretations, I mentioned this earlier. I just want to, these are industry specific, and I'm going to try in these general updates to continue to list some interpretations that we've made recently that I think try to illustrate to everyone what's going on. In terms of masks, you have to wear a mask indoors. That's maybe not an interpretation, just a direct reading of the state public health or mask order. Need to wear a mask, some sort of facial covering indoors at all times. Your caveats are if you have a medical exemption, or if you're in a room with 4 walls and a closed door. I had a long conversation with someone today, kept mentioning 4 walls and a door, and finally I said, and the door has to be closed, and they were like, oh, it has to be closed. So yes, you have to be alone in a room, it has to be closed off. That's really important. In terms of, this is a one that just recently came out, swim lanes. There's been a lot of questions about swimming, both indoors and outdoors. If you're swimming with your family or someone from your household, you can share a lane, but unrelated individuals should not share lanes. You should try to maintain 6 feet of social distancing in the pool and out of the pool. Obviously in the pool, you can't wear a mask for safety reasons. Outside of the pool, you should wear a mask and maintain 6 feet of physical distance at all times. We are working on the drive-in theater guidance. We're looking at ways to include bikes in that. So that's something we're trying to come up with, some clear rules for providers there. And then just reiterating from a couple slides ago, staff and store owners may deny access to anyone unwilling to wear a mask for whatever reason. If they have a medical exemption, that does not mean they can claim a medical exemption and you have to let them in. You are allowed under state law to deny access. I haven't talked about this in a couple weeks, but I thought that we had some exciting milestones this week with Protect Our Neighbors. Again, we don't know if we're going to go to Protect Our Neighbors. That is a choice that the Public Health Department needs to make in consultation with area doctors and our area hospitals and our county commissioners. But these, hard to read, I know, probably on a small screen, but there are 9 metrics and only 8 on here somehow. But there are, these are the metrics that we have to achieve in order to apply to go to Protect Our Neighbors. Out of the 9 Protect Our Neighbor metrics, we've met 4, which is great. We've partially met another 4, and then there's 1 we haven't met yet. So we are making progress, which is great. And we are continuing to push for that. So I think what the message I want to send out to everyone is we are making progress. As long as we continue to wash our hands, stay physically distant, wear masks, we will, hopefully continue to see improvement. So with that, we have these general update meetings. This week there wasn't, we didn't have a big change, so I didn't really have a ton to talk about, but that's why I wanted to get through these slides so we can answer questions as much as possible. And we will not be having a special session today at 4, but next week we will. And I believe Corinne sent out emails about that. It's for rental properties and managers of rental properties. So Hope you'll join us if you're interested in that. And then the Spanish language session is released on Thursdays. And we do that in collaboration with the Boulder Chamber and the Latino Chamber. It's a lot of this same information, but one of my colleagues does it, and I'm sure she puts her own spin on it and has some interesting ideas that she brings to it. So if that is of interest to you, please do listen in. So with that, just a reminder that our call center is open 9 to 2 if you have complaints. And if you have questions or comments, please do email us at covidbiz@bouldercounty.org. All right, thanks.
Thanks, Jesse. So we had one question, which is, even if I didn't register for today's session, and I'm going to answer this question, so you don't have to worry about that. Even if I didn't register for today's session and used a previous link, will I get the emails? And the answer is yes. So I send out the email to anybody that's registered to these so that you continue to get the resources that you need in the recordings. Another question came in about the actual where we've met and not met the metrics on Protect Our Neighbors. And I actually brought up the website if you want me to share it.
Sure. I mean, I can take us back to this slide as well.
Well, and I can also bring up that live tracking page on the
Perfect.
website.
Yeah. All right.
To show people. So let's start with, I'm gonna stop your sharing and share my screen.
Perfect.
Oh, goodness. All right, so let's share my screen. You got it, Jesse? You got my screen up?
Yep.
All right, yeah. So on the Boulder County site, which is the site we send out, this is a good thing for, especially those of you that are new to see. There are a lot of tabs in here. Like they said, they reorganized it a little bit, but you'll see there's a little thing that says Protect Our Neighbors space, and it gives you an opportunity to track where we are on those metrics. So where Boulder County is on those metrics. So if you want to kind of go through those, Jesse, I'll scroll for you. Sure.
So I guess the sufficient hospital bed capacity and PPE we've met. We have plenty of space there, and our PPE is at 100%, which is great. In terms of our hospitalizations, we have not met that. They measure it over a 14-day period, and we haven't met their metric yet. In terms of fewer new cases, there are 2 ways to meet it, and I don't actually know much about how we've partially met this, so I'm going to do a little bit of reading here. And it looks like we haven't met under option 1, and under option 2, we're not, I don't know how we've partially met that one, but we're making progress, I guess is what I would say, without reading through it and spending too much time on it. Our testing capacity is really, it's sort of a strength. I think we've got a number of testing locations throughout the county. And actually, Corinne, thanks for bringing us to this website, because this website also has a place where you can look up where all the testing facilities are in the county and what they need to, whether you need to be symptomatic or you can be asymptomatic to get tested, whether they accept insurance, all those sorts of questions that you might have are all answered on this site. In terms of local public health agencies, our capacity, we are building our capacity, and that's, I think, we have a plan and we are hiring people, but we have not met their requirements yet. In terms of our strategy, yes, like I said, we have a plan, so that puts us in good stead in case there is a surge. The testing plans are in place, and we are developing our overall plan in case a surge does occur. And so I think the key here is that you guys created this website so that people can track where Boulder County is.
Also
Yep.
on here are there's a stats page. I send that out every time. You can track the statistics, the spread of the disease, the statistics that you go over in this webinar. If you want to refresh it every day and see where our 5-day average is, it's something that that it would be valuable to continue to monitor. Also in here, for those that are new, there are guidance for businesses. So we have general workplace guidance and then industry specific guidance. And that's the same thing as on the state website. You're going to see there's a lot of specific guidance for businesses and sectors. If you're new, it's a good site to look at because, for example, I know we have a new event facility on today's call. So you're going to want to go to the state website and click on outdoor and indoor events, and it's going to detail what you need to do as a venue, as employees, and as attendees for an event facility. So, Boulder County used to create checklists and we did that, but that's all very well detailed on the state site. And if there are questions about any of those, please do not hesitate to reach out. So I just wanted to point out some of those resources that maybe we haven't shown in a couple weeks, but I know we have some new people on today's call. So I'm going to stop sharing my screen. You can share yours back up.
Okay.
If there are some more questions for today. So we have a question. All right, so we talk about the signage, that sign that says do not enter without a mask, and anybody that got my email this week, it said do not enter with a mask. So that was a typo, but luckily the signage is correct. This question came in via email and is also on here that there are offices that are small. There's 6-person offices. People have to come by appointment only. Visitors have to be buzzed in. Do they still need to put a mask on that's a sign on that says do not enter without a mask?
Yes. Any public indoor space. If you're, one thing I would say is if your office is in a larger building, I would recommend you put it at the front door of your suite of offices, but it can also be at the front door of the building. These signs are free to print. They're available on the state website, and you can just slap it on the door. And one thing that's really important to note is these signs are required. They are part of the mask order. So if a client came and decided to complain, you'd be getting a call from me. I try to be nice. Sometimes early in the morning without coffee, it's rough, but I am, we're here to try and educate and help, but really this is an easy one and we really want everyone to hit this one.
And I added the state signs to the Google Drives with all the signs that we had in there before. So we have the state sign as well as a sign that we created, which says do not enter without a face covering. So when you say public, open to the public, I go in and I see my coworkers and I don't think of them as the public. Is that a public facility?
Yes. Yep. Any space that is any office, any business, regardless of whether you have customers, because you're mixing people from various households, you're coming in from outside, that's all public. Public indoor space is any space inside that isn't a house, a dorm, or a hospital room, really. It's very, these are public spaces, you need to be wearing a mask. And actually in a hospital room, I hope you're wearing a mask too. But yeah, in your house, in a dorm room, you're accepted. Other than that, if you're indoors, wear a mask.
Well, in some cases, we go into our building and we think about it. And I even showed up at my office this weekend. I was like, oh, we got to switch the sign out because we might have had previous signs on there, but it's an easy print. Put this up, you'll avoid getting in any sort of trouble if you are an indoor space that has people that are not related coming in, not a house. Okay. So there is a psychotherapist on the call, and they're looking to do group therapies outside. They're going to have social distancing and masks. Are there other things they should be aware of or a resource sheet that would be helpful for this group? Would you consider this under limited healthcare? Where would you tell this person to go?
Yeah, it's limited healthcare, so that's where I would go for all of your overall practices. The outdoor thing, it's a good idea. You can have groups up to 10, so that's great. You could have a group of up to 10 people, that's including the practitioner and any support staff. Again, socially distanced, wearing masks, all of that. But it's a great, actually, yeah, I encourage that. That's a great idea if you can get outside. It really is a great way to reduce the chance of transmission.
So when we were looking at that state site before the county site, you're going to want to go to the state site and you're going to want to look under sectors under limited healthcare and follow those guidelines.
Yeah.
It specifies the type of masks. It specifies, the contact tracing, any of the indoor, outdoor type stuff that you need to do. Like I said, we have quite a few new people on today's call. So
yeah, and so yeah, I'll repeat the address for that website is covid19.colorado.gov, and I'm sure Corinne includes that link in her mail. But yeah, the other way if you just search for COVID-19 Colorado, it almost certainly is one of the top links. It's the CDPHE, Colorado Department of Public Health and Environment website. Dedicated to COVID-19, has tons of information, frequently asked questions, links to printable things. You can look up personal, information about your personal safety as well as for your business sector.
All right. So we also have a new event facility on today's call. Sent them all the resources and the previous recordings and some of those things earlier today. But there's the question of, they have an indoor community event space for private meetings. Do they still have to follow the social distancing requirements in that social distancing calculator, even though it seems a little extreme?
Yes, you do. Yep. That and the idea behind that social distancing calculator is if you have, if you think about being 6 feet apart from one another, that's great as long as you're totally still and no one else is walking in the room. But say you have a person walk between two of your clients, they've just broken the 6 feet rule and endangered both people who were on either side of them. So the 6 feet is 6 feet around you completely, and then 6 feet around the person next to you completely, which comes out to about 144 square feet, not about, exactly, 144 square feet per person. And that is, it is a lot of space. A lot of indoor spaces can't handle that many people, but that is in order to protect your customers and your business, because if an outbreak were to occur, your business would be the one in the news, and you don't want that, we don't want that, your customers don't want that. I think the 144 square feet is really a protective measure that's pretty well accepted around the country.
And about 2 weeks ago, we did a special session where we reviewed all the events guidelines again. I think that was exactly 2 weeks ago. Yep. Or 3 weeks ago.
3 weeks ago, I think.
At this point, yeah, 3 weeks ago. And I did send that video, but it'd be good to review because, yes, 1,200 square feet may only mean 7 people. But we also talked about how the nature of events might have changed a little, where networking is, when you're 12 feet away from somebody, that networking component of an event, that some of the event facilities are looking at, how can I be a sit down, can I change this up? What kind of things can I offer? I've spent time on calls with event facilities, brainstorming different types of events they may still be able to run using these guidelines. So, we've got best practices of live streaming so that companies can do hybrid events for people uncomfortable indoors, expanding into outdoors. We talk a lot about how when you start to do food service, you're actually going to have to follow the food requirements, the food service requirements, even if it's an event facility, and how you're going to have to work with the people actually planning the events so that you both are following the guidelines. So again, I would encourage anybody new that hasn't been through an industry-specific webinar to really check out a previous recording and to reach out to us. You'll get a follow-up email, reach out to us with any specific questions. All right, so I heard in the news this week, and some other people had emailed me, that Adams County and Aurora set up these new free testing sites, and that they're encouraging local areas to look at expanding free testing. Is Boulder County looking at setting up a similar site, or what's the plans there?
So I have not heard about any new free testing sites. I will say that as far as I know, there are at least one of the sites does provide free testing. It may be means-based, but I don't know. Lane is on the call, but he may be in another meeting at the same time. I don't know. I can look into that and get back to you about that.
I saw you unmuted, Lane.
Updates for you. Sorry, Jesse. We will get probably an update. Unfortunately, it's tomorrow rather than today, but we will hear from our testing folks that are kind of overseeing that tomorrow. But I haven't heard of any new major expansions like that as of yet, but that could be underway. But again, sorry, we're a day off of hearing that update.
So for right now, there is the list of testing sites on the Boulder County Public Health website, and then anybody that read the news knows that the one in Adams County is in Waterworld, and they're planning to do about 2,500 tests free of charge, a day, and you don't have to have a doctor's note. That's the current news, and anything additional we get, we'll send out. But please keep checking the Boulder County Public Health website for testing locations. We've also talked to a lot of employers who have contracted with local hospitals to do testing on site at employers. And that is also available to local employers with some of our local hospitals. Okay, so what is your advice for a company that may have one person that was exposed and test positive? It's not considered an outbreak, but should they still contact Boulder County Public Health, and who should they contact, and what can you help that company do?
Yes, so you can contact the email that I shared. It's covidbiz@bouldercounty.org. And actually, I was just looking at the testing website to see if I could give you any additional information, but I'm going to switch over. Once I get to the page, I will share it. We do have information for if you have a sick employee. There's also information about sick employee, or what to do if you have a sick employee, on the CDPHE website, covid19.colorado.gov. We can walk you through the steps that you need to take. Basically, the broad thing is that person needs to stay home. They need to get tested. If they don't want to get tested or whatever, they just need to quarantine until they have no more symptoms. And I believe it's 14 days, but don't quote me on that. Read the materials. You can call us or email us, and we will walk through the whole thing with you. In terms of exposure to other employees who were in close contact with the employee who is sick also need to stay home from work. That's a precautionary measure. So definitely, if you had this happen, contact us. We can walk you through it. I'm not going to walk through the whole thing because I don't have it in front of me. But if you go on our website, let me see if I can quickly find it here.
The key point is there that even if it's not considered an outbreak, which is 2 or more, you should still contact, because you can help the business navigate that uncertainty.
Yes.
I had a business talk to me today about, we're following everything, we're doing masks, we're social distancing, we're cleaning, we're trying to mitigate the effects if there was. And the question is, it came across, will I have to shut down my business for days if we had one? And I said, that's where you want to talk to Boulder County Public Health, because they can help you trace that contact that person has, the potential contact that person has had within the company, and the extent to which you might have to do quarantining and closing down. Jesse, you just went away a little bit there.
So, okay, let me see here. Sorry, I turned my video off because I was having some lagging issues. Let's see. I'll keep looking. If there are more questions, I'm happy to answer them.
So we have another question about testing. With so many states requiring travelers to get a COVID test before arrival, where can people get tested for this without having to claim symptoms or saying they've been to a hotspot recently?
It's a good question. I am actually leaving the state to go visit relatives, and I have to get tested. So what I recommend is you look on our website again. There's a list of places that you can get tested. And then on top of that, if you go to the COVID19.colorado.gov site, they actually also have a list of places you can get tested throughout the state, and it tells you if you need to be symptomatic or not.
I'm actually going to share that screen again.
Yeah, I will. Let me get back there.
I can do it. I'm on there.
What's that?
I'm on the site, so I'll share my screen for you.
Okay, perfect.
So on the main Boulder County page, you can see there's a testing link, and then down there, it talks a little bit about what a positive antibody test, the sites, and then it goes through every facility within Boulder County that does testing, whether or not you have to be symptomatic, whether or not you have to have a doctor's order or an appointment. I know personally, I made an appointment with one of these places to get tested when I felt like I had symptoms. I made an appointment. I didn't have a doctor's note, and then I got the test results within a certain amount of time. So these are the ones in Boulder County, and then as he mentioned, there's the state site as well that may list the ones that are outside of Boulder County. All right, Jesse, do you have anything to add? I thought I would help since you're lagging a little bit on your computer to bring up that site.
Yeah, okay. Having trouble. Actually, I'm having trouble hearing you as well. Let me just switch over here for a second.
I don't get that often. People tell me I'm pretty loud.
Perfect.
So.
Can you still hear me?
We can.
Oh, great. Okay. Let me see if I can find that site again. So which site, do you want me to find the testing site or the?
I just showed it to everybody.
Oh, perfect. Thank you. You did. I saw it. Yeah.
No, we're good.
I was freaking out about sound.
We're only on week like 14 of these, so I think we've kind of got this thing going. So I had a question come in about, now we're going to shift gears a little bit. So we talked testing. There are sites on there. It tells you whether you have to be asymptomatic or you have to be symptomatic or asymptomatic. If you need a doctor's note, the costs. Again, the state site will list some of those new testing sites that have been opened in this past week. If you saw the governor's press release at Waterworld, that might be an example of another facility that's open for people to go. Now we're going to shift gears to food service, hospitality and food service a little bit about ice machines. According to food service, you can't have any self-service. You can't have any self-service drinks.
Yes.
How do ice machines work, like at a hotel or at a business, or what are the rules?
I think that's the easiest way to do it. If you have them in a hotel, they should not be available. And at a restaurant or something like that, what you'd want is an employee managing the provision of ice into the drinks.
And I've seen restaurants give new cups and everything they don't refill the old cups. They give new cups and so forth for the different products.
Yeah.
All right, so I think I got all the questions that came in via email. Okay, so this person went, the psychotherapist went to the Limited Healthcare website, and this was your area of focus before. And Limited Healthcare says that we all need medical grade masks. Would that apply to that group therapy or to that actual, just the therapist for the medical grade mask?
So the medical grade mask does need to be worn by the therapist.
How about the people?
But not the rest of the group. Yes, the rest of the group can wear homemade masks or any other mask that is available to them.
Okay. And if somebody does contract COVID in the group, are there considerations around reporting? What needs to happen when it's a client or someone within those therapy groups that does test positive?
You know, I don't know exactly if there may be, okay, first I would check the DORA, that's Department of Regulatory Agencies website. They have guidance for your specific profession that may include additional information about if you happen to, if a client happened to become sick. What we do and what the state does is if a person tests positive, that information is reported to the county, and the county then contacts the person who is sick and that's when that contact tracing starts to happen. And we would get in touch with as many people as we could, including probably you, and then it would be helpful to know who else is in that group so that we could get in touch with them. I don't know if there are any HIPAA related questions with respect to treatment, but that would be outlined in the DORA guidelines. And I have a feeling that whoever contacts you through, you know, the contact tracing would know more about exactly how much you can divulge and how safe that is. But in terms of your responsibility, I would look to your professional associations and to the DORA website to explore if you, as the provider, have reporting responsibilities. That's not something that's outlined in the guidance.
Okay. So, you know, check with the DORA, but the key there is before you start contacting all the parents and all the people, to contact Boulder County Public Health, because they'll help you navigate you through this process, and it's usually part of their contact tracing process.
Absolutely, and I would say to add to that, there are sort of two ways we go at this. The team I'm part of, we don't actually contact patients. We don't contact the people that got sick. We will contact you as the business. The contract tracers will get in touch with us and say, hey, this person, you know, works at this business or attended this thing, can you contact the business? And that's when we will reach out and work through that side. So there are a number of ways that you will be contacted. And you know, that it's all part of that trying to figure out where they were, where they've been since they contracted COVID-19.
But the key to the personal services, to the limited healthcare, you need to have a good documentation of who has come into your facility or been part of your services, when, and what groups they were in. So that it's really good to have records of those.
Yeah, across all industries, the better you know who's been in and out of your stores. Obviously, for retail, that's really hard to do, but for some of smaller businesses that are providing direct services, knowing who's coming in and out, and that can be as easy as, you know, if you're a gym and as people walk in, they scan in or whatever, you know, they have a tag, that's a record of them being there. That's a great tool to know who is around at a particular time.
And an event, and if you're a venue, even
Yes.
if you're the venue, the partner that you're putting on the event with will need to provide you also the documentation of who was there during that event, so that
And
you,
that's all outlined
as the
in
venue,
the
have
guidance.
it.
Yes, yeah.
So still unlimited healthcare, do they need to do temperature checks of the
For the
clients?
limited health, yes, yeah, that's part of the guidance. Yep.
If someone, so same person, if someone tests positive, let's say within a group, will they need to close down for 2 weeks, or is that something that will be worked through when you do this?
We would work through that with you. In terms of that group, I don't know. We'd have to look at that and figure that out on a case-by-case basis. But a practice might not need to close down if only a certain number of staff were in contact with that individual. Then the practice could continue. Obviously, we would encourage things like lots of cleaning, things like that. But if you, I mean, I think the easy answer is always, if you have an outbreak, or if you have a sick patient, or if you have a sick employee, any of those things, contact us. We can walk you through all of the details. And it's much easier to talk once we know details about the business that are hard to do in this setting, much easier to do over the phone or in a Zoom.
That's why I kind of provide some general, the key though is to prevent exposure, make sure you're continuing to do the social distancing. Don't be lax on that. Wear masks, wash your hands, clean surfaces, and continue to do the cleaning. Don't let people come that are sick. Those key tenets that you talk about will help to prevent some of the potential exposure if you do have someone that happens to come into your facility that's sick. Okay, so you showed some really positive signs, some really great numbers, relative, moving towards that protect our neighbors. But we are 1 week into students moving back, and we have some schools opening, but we have some staying at home. We have going to have a lot more activity going on in our community. Is there any thought of how this might affect those numbers? What are some of the preventative measures happening in place to help our community to maintain these positive trends?
So I think in terms of what's going on with outreach, with communication with the students and CU, as well as with high schools and high school students, we have a whole group that's focused on education and working with the school systems. In terms of CU, we're working with the university, with police, with groups within the university that work with students who live off campus, students who live on campus. The university has produced an entire plan for how they're going to bring their students in, the testing that they're going to have to do, the education that they're going to have to do. We've looked at, on the enforcement side, how we're going to clamp down with the help of the police department, as well as other students and neighborhoods, how we're going to clamp down on parties that could become the sources of outbreaks. There's actually been a lot of work, and there are a lot, I think not just has there been a lot of work, but there's been a lot of work from a lot of directions and into a lot of directions to try and figure out the best way to allow these students back into our community and give them a place where they can learn safely and we can live safely. So I think there's a lot going on.
And I think that's the important message to businesses, is that these community conversations have been happening for months in preparation for students coming back. It's not going to be perfect, but we're working on the best way for communication, for collaboration, for all of that. For example, next week's special session, our 4 o'clock session, will be for residential property managers to talk about the requirements per CU, City of Boulder, Boulder County, and the state. So that's the special session that we're going to talk to that population to make sure that we're clearly communicating some of these requirements. All right, I don't see any more questions, and thank you both again. Sorry if we couldn't hear each other for a little while, but we got through it.
Sorry about that. Yeah,
we got it. I have a computer, I can share screens too. So we hope to see people next week. Do not hesitate to ask questions in between. And if you have specific questions that they weren't answered on this call, because check the previous webinars. They're all available on our YouTube site. Check some of the previous resources or ask a question. That's always one of the easiest ways. And we look forward to seeing everybody next week.
Thanks so much, Corinne. Thanks, Lane. Bye, everybody.